I think that's everyone. Okay, great. So again, we have a relatively full agenda, 4 main updates, it looks like. I'll go ahead and get started. I am co-chairing a small interagency working group that is tasked with reviewing and revising the principles for the conduct of research in the Arctic. This is a document that was put out by the Interagency Arctic Research Policy Committee in the mid-90s, and actually gave a very sort of brief overview of this activity back during our July meeting. This small interagency work group basically is looking to strengthen these principles, which were originally designed or recommended by a social science task force of the National Academies of Sciences, the Polar Research Board, as a means to really develop important ways or solid ways to improve researcher community engagement. And so early this year, a small group was put together with representatives from NOAA, from the U.S. Arctic Research Commission, from NIH, from the CDC, from the U.S. Geological Survey, and I think 1 or 2 others that I'm not remembering right now. And essentially we developed an approach that was going to be comprehensive and really driven by inclusive engagement with communities and indigenous scholars, as well as federal agencies that either support and conduct research in the Arctic. And so I just want to give a brief rundown of sort of what we've accomplished in the past few months. We've taken a multi-step approach really at doing a thorough comprehensive review and revision process. So one of the things that we started out with was a literature review, which is being led by the National Science Foundation and their current AAAS Science and Technology Policy Fellow, Dr. Amina Shartoop. She has been collating and compiling many of the documents that have come out in the past 22 years since the original principles were published, gaining insights from Indigenous peoples organizations, from different federal agencies, and even from professional organizations that conduct research with Indigenous peoples. So that literature review is ongoing. A second important step that we've taken is to publish a Federal Register notice, request for information. This was released in mid-November, I think around the 16th, and is open until mid-January. I believe there's a link on the agenda for those of you who want to sort of click on it and see what that information is requesting. But essentially it lays out the context, a little bit of the history of the principles, and even gives some sort of guiding questions about you. It's not to say that even though these principles are a little bit dated, not that they don't still have some value, but we are really seeking better ways to improve, strengthen the different aspects of community and researcher engagement. So that will be ongoing through January 16th as the last day to offer comments. A third approach that the Interagency Working Group has taken is to host listening sessions at different research conferences. We started in October during the Alaska Native Health Research Conference. I was in Anchorage and led a small breakout session, essentially asking community members and researchers and clinicians and other service providers to help provide feedback on the existing principles, share some narratives about their experiences with communities or researchers depending on their particular role. And we're hoping to continue this process at least until mid-February. There have been a few other research conferences since the Alaska Native Health Research meeting, and we just held a listening session during the annual AGU meetings, the Geological Union meetings. And so I think we're progressing very, very well in that regard. The last manner in which we are gaining input from the broader community research community in the Arctic is through targeted interviews with particular stakeholders who have been involved in research guidelines or community engagement, including Indigenous scholars, community members, federal program officers, and researchers. And so we are, again, targeting particular individuals who have had a good, strong history of working closely with communities through community-based participatory research approaches, and making sure that we get their insights and synthesize those into a subsequent revised draft. We are hoping, I think optimistically, to have a revised draft by, I believe, early March or late March at the latest, and then a second federal register notice for final input. And so there are, I think it's a very valuable undertaking that we are conducting to really strengthen the different ways in which researchers and federal agencies that conduct research or fund research in the Arctic with indigenous communities can continue to foster partnerships and collaborations going forward. So I'll leave it at that. If some of you are involved in providing comments, I know, or if you want to find out more information, you can certainly click on the link to the Federal Register notice or reach out to me directly afterwards, and I can give you additional background information, or if you have other means of commenting, we'd really appreciate that input. So I'm happy to take any questions for those anyone who has them at this point. I'd like to thank in particular folks on the call like Cheryl Rosa, who also participate on the federal working group, and Tom's colleagues at CDC who are able to participate as well in our efforts. All right. No one has anything to ask. We'll go forward. The second main update today that we're going to hear from is about a forthcoming report on assessing the potential health impacts on climate change in Alaska. And this will be presented by our other co-lead of the collaboration team, Sarah Yoder.
All right, good morning, everyone. Thanks for calling in on this, pre-holiday week. I know everyone's probably pretty busy, so thanks for making some time. I just wanted to give a kind of a heads up of a project that we've been developing here at the State Health Department, Health and Social Services. So for the section of epidemiology where I work, we have for a couple of years now been looking at the potential health impacts of climate change on human health in Alaska. So it's been a pretty broad, long project. We're loosely calling it a health impact assessment. We do follow the framework of health impact assessments that we've outlined for the state of Alaska in a HIA, so Health Impact Assessment Toolkit. But really what this document is it's the, 80 plus page report providing a really broad overview of the range of potential adverse climate change impacts on human health in the state. And then it also presents some examples of strategies that communities and decision makers can consider when developing their own climate change actions. So really ensuring that human health is included in all this climate change discussion that occurs, and any subsequent planning efforts, advisory groups, and whatnot. So kind of along the lines of this report, the state of Alaska, under the governor's new administrative order, is really getting moving on talking more about climate change, developing some planning documents, talking about adaptation and mitigation. So the governor established an Alaska climate change strategy, as well as a climate action for Alaska leadership team. So these are two groups. One's an internal agency group. It's mostly at the commissioner level for different state agencies, and they're looking at, climate adaptation strategies, mitigation. And then there's a more public team. So there's members from University of Alaska system. There's members from just general public. There's some youth members of the public team. They had their meeting yesterday, which I was able to attend, and they're pretty excited about this health assessment report, just so that they have a long list of all the different health things to consider when they're looking at different strategies. So that's a really broad overview of my report. We get really in details. We have 8 different health effect categories. We divide all our potential adverse health impacts into everything from mental health and well-being to chronic disease, healthcare infrastructure, water and sanitation, accidents and injuries. And this report, word on the street is it will come out in January, perhaps early January. So hopefully that is indeed the case, and we can talk more specifics about the report after that. I know that was pretty quick and pretty broad. Are there any questions on things that you'd like me to elaborate on a little bit more?
Hi, Sarah. This is Carrie from the U.S. Arctic Research Commission, and you mentioned that there was a section on mental health and climate change. Can you talk a little bit more about that? It relates to something I'm going to talk about when I give you an update on our working group.
Sure. Yeah. Thanks, Carrie. So in our report, we don't really rate potential impacts, but we did identify that probably the biggest impact in terms of geographic scope is going to be related to mental health and well-being. You know, we've got people who are anxious about, you know, a change of their way in life, anxiety about, you know, if they're going to be able to get their food for the next year because of ice conditions, just a bunch of different, you know, environmental change that can relate to more psychosocial change. So you really tried to just describe that a little bit and put it into context for the reader, you know, that there's a lot of different pieces to the mental health component for climate change, but it has come up in every meeting we've attended. You know, someone always mentions it right off the bat on things that they're worried about for climate change. And even that worry, you know, is a potential mental health impact. So it's the first thing we talk about of specific impacts in our document, and I think that's for a good reason. Yeah.
Sarah, this is Roberto. I don't know if this is an appropriate time to mention that there are plans to have a webinar, I believe it's in late January, that is led by the National Indian Health Board. Tom, I think, actually put us in contact with the organizers that is around climate change and health, particularly in the Arctic, looking at impacts on Alaska Native communities and spotlights on efforts to improve climate health. You want to say a little bit about that, or Tom, I don't know if you want to chime in a little bit on that?
Well, Roberto, I don't know too many of the details other than that I will also be talking about our state report at that meeting. Let me see, I can maybe pull up my calendar. That might be a detail I can provide. So this meeting will be on January 25th, 11 o'clock Alaska time. How many other details do you have that that I can't provide?
Tom, do you have anything else? I received a sort of a draft description. I guess I can say a little bit more about sort of what the objectives of the webinar are. It is basically should lead to participants explaining climate change's impact on health. So it's a little bit broad, describing special considerations for Arctic communities in the context of climate change in the health sector. Some efforts to discuss ways to improve climate health in Alaska, and ideally also identify some resources related to climate change and health for tribes. So, you know, I think just disclaimers aside, I'm also been invited to participate in this webinar, though I don't have final details of exactly what I'm going to be sharing, but I presume it'll be tied a little bit around the mental health aspects, and it's something that we need to finalize within the next month or so. But essentially, you know, the draft agenda, it's going to be approximately an hour and a half event following welcome introductions, an overview on climate change and how it can affect health, particularly within the Arctic, then a little bit on climate health work that's currently occurring, largely through the tribal health systems and the state, including some community level assessments. So I imagine that's where your role, Sarah, might come in, talking a little bit about the report. There will also be a segment on how climate change is affecting Indigenous peoples and their lifestyles, which I think is definitely a serious consideration, including some tribal champions that was work currently being done. And lastly, it concludes with available resources, including partnership opportunities and recommendations for tribal communities experiencing climate change. So yeah, I think, based on this general description, that I think there's some real value there. People are beginning to think about it, and Carrie will also, I think, reassert this, at least with the mental health component. So once we have final details, we can certainly post to the APHA Collaborations website and try to disseminate the details more widely.
This is Tom. Can you hear me now?
Yeah, there you are, Tom.
Good. It's odd. I had audio at the very beginning, and then I was trying to say things, and I realized. So,
no, we weren't hearing you. Sorry. Go ahead.
It's like one of those bad dreams where you're shouting, So, Roberto, I had to cut out, but you were talking about that webinar that National Indian Health Board has set up for January 25th, and Sarah gave the time. So that we have a meeting on that this week to further the details on it, but I think you covered it pretty well. And Sarah, I had a question for you about the health impact assessment. In an earlier draft, there was some discussion about whether you might include some potential benefits from climate change on health, such as increase in the length of the growing season and more agricultural opportunities and greater food diversity. Did that get put into the report, or is it still focused on negative aspects of climate change and health?
It's still focused on negative impacts, just in terms of, we really want to provide help to help people prioritize, things that maybe they can adapt to before, anything negatively happens. But we do recognize that, there are definitely some benefits that should be mentioned, and we allude to it, but we don't really approach it with the same degree of detail that we do the other potential impacts.
Yeah. And
maybe that could be a document for another day.
Yeah.
Part 2.
Yeah. So you think you'll have that kind of cleared and then published on the State of Alaska website in early January? Is that what you're aiming for?
Yeah, that is what Joe McLaughlin said yesterday during that climate change meeting. So I'm thinking that means it's happening. It'll be published like in EPI Bulletin. We'll also have a link to it on a couple other places on the state website. We already have talking points ready and everything, so I think we're getting there.
Okay. Just something related to that, the Global Change Research Program is coming out. They actually have posted the draft version of the 4th National Climate Assessment Report in NCAR 4. And that has 2 volumes. One of them is sort of a global look, and then the second volume has region-specific chapters, and there's a chapter on Alaska, and one of the topical areas in there is health, human health, along with a lot of other aspects of it. Carl Marcon, who used to be at USGS, is the coordinating author for that, and that's been going through the review process and should be released sometime after the first of the year for public comment also. So that's another aspect. And Carrie, to your point, the mental health component is very much featured in there, as it is in Sarah's report that's coming out. So I think there'll be some more opportunities to highlight the mental health components of climate change.
So Tom, can I ask, so the second part of the USGCRP upcoming report, you said is going to come out for public comment early January?
I'm not sure the date or when it's going to be released, but okay. I was led to believe that it was sometime this winter. Yeah.
It's already out.
I know something came out. Yeah.
This is Roberto. Yeah. The public comment period for the National Climate Assessment 4 is out at this point. So yeah, you can check on the USGCRP website. There also, I believe, was a Federal Register notice. I can provide links and information. I'm also a co-author on one of the sectoral chapters. I contributed to the Indigenous Communities chapter, including a small component on mental health.
Roberto,
yes.
What I'm looking at on the GCRP site is the kind of overall chapter, not the region-specific one. So the Alaska unit of that, I think, is what hasn't been released yet.
Oh, I see. Okay, I thought.
So I think
Section.
there's two reports. One is the one that you just alluded to, and it's on the GCRP site. And you're right, we should put it up so that people can look at it. But there's an Alaska-specific chapter that isn't out yet that I can see.
Okay.
And that is more to what Sarah was just talking about, is the health aspects of climate change in Alaska. That also has a review of that, and they're complementary information anyway.
Yeah.
I think one of the things that, and I worked on that health unit for the GCRP report, I think one of the challenges is finding documentation of adverse health effects that are that can be linked directly to climate change. And I think Sarah.
Agreed.
Yeah, and Sarah, and looking at your report, you do a great job of looking at trends that would likely lead to adverse health consequences. And I think they're all logical, but I think where we really have, and maybe this is a good thing, but I think where we really have more work to do is to try to find actual documentation of events that you can really link A to B to C, to say climate change resulted in this adverse health consequence. And the reason I said maybe it's a good thing is that maybe the lack of evidence means that we haven't seen a profound impact on human health, or maybe it's just a matter of lack of evidence. I don't know. What do you think, Sarah?
Yeah, I agree with you. That is the main reason why we weren't able to really rate potential impacts. Well, that every community might experience something a little differently, but it's just so subjective right now with the lack of that data, and we can't really identify the risk attribution of climate change specifically for these different impacts. So that's why we had to keep it a bit more broad and less specific ratings about severity and everything. So I agree. I think that is something that needs to come next, I think, in the science.
Sarah, this is Roberto again. On a related note, so even though you don't have the sort of specific impact indicators on the different health areas, was there an attempt to discuss potential adaptation strategies in response to different challenges?
We do have an adaptation section.
Okay.
So we've got, there's two tables in this adaptation section, and they're more the broad scale adaptation plan or adaptation strategies. So that would include, let me see if I can pull it up real quick. It would really include more things like making sure you're addressing human health and climate change vulnerability assessments, or that you're building up community resilience. So a few more broad things. And then we do have more specific adaptation strategies, like developing surveillance programs for certain impacts. Let's see, try to talk and get to this page at the same time. And another strategy, reviewing architecture and engineering designs to ensure that infrastructure can withstand changes to the underlying permafrost. To continue supporting the LEO program and adopting a One Health strategy for, or a more wide adoption of One Health consideration and research. So some broad things, some specific things. The long answer to your question. Okay. Yes, we do have some adaptation.
Great. Does anyone else have questions for Sarah?
We also provide some monitoring resources, so ideas of indicators that communities or state agencies can be looking at from year to year, and then some resources on agencies that are already collecting that data.
When we looked at this from a couple of years ago, we did a joint program with the University of Alaska Fairbanks to look at climate-sensitive zoonotic infectious diseases that we would want to keep an eye on, and we think would probably increase or have some kind of change in a climbing or in a changing Arctic climate environment. And although I think we came up with a good list and published that in the International Journal of Circumpolar Health, I think for almost every one of those conditions, the conclusion was our surveillance systems are inadequate. They're insensitive to our ability to detect these conditions, partly because of problems in rural communities not having either access to care or diagnostic capabilities, or a lot of the health conditions mimic other things and are treated empirically without a diagnostic test being conducted, and some of those aren't even notifiable to the state of Alaska. So we lose a lot in the public health system by not being able to detect these. So I imagine that's still a problem going forward. And Sarah, I don't know if there was any discussion within the state of Alaska section of epidemiology about how to strengthen surveillance around potential climate-related health threats. Are there any specific recommendations coming out on that, or is it an area that you think will be worked on in the future?
I think it will be worked on in the future. I know it's been discussed, especially a few years ago when there was another version of the state leadership team looking at climate change. It does come out as a adaptation strategy in our document to let me see if I can find the wording, essentially to develop some surveillance systems, but it's not very specific, this recommendation. So maybe we could add a little bit more fine tuning to that.
Yeah, I think that fits in well with the idea that you put forward in that of taking on a more of a One Health approach too, because a lot of the signals for adverse human health risks will come from either environmental monitoring or monitoring in animal populations, non-human animal populations. And there's already some good work going on in that area. And I think linking those efforts in a way to understand those risks will help a lot more than just trying to detect more cases in humans, because I think there's the broader perspective is really what's needed.
Right.
Some of the work that ANTHC is doing in their RAMP program, the Rural Alaska Monitoring Program, to detect, for example, Francisella tularensis in mosquito populations, or to look at other antibodies for zoonotic pathogens in hunter-killed animals. Francisella, for example, those are all interesting ways to look at risks in the environment before they become a direct threat to humans. And I think there's a lot of opportunity in all of that to broaden our surveillance definitions, to think more widely about the threats to human populations. And that's mainly just from the infectious disease standpoint, but I'm pretty excited about that actually moving forward.
Yeah, I agree.
Roberto, I tried to ask you a question earlier about your principles of conduct of research. And I guess there were two questions that I had. One is, are you seeking input from a broader Arctic community? I realize this is a US government document, but do you want input from groups outside of the US?
So ideally, yes. And I reached out to our State Department colleagues through the Sustainable Development Working Group to get input from permanent participant organizations. So we are trying to make that effort. But as you identify, yes, our primary focus is in the domestic setting because it is a federal interagency document.
Yeah, I know for the Arctic Council's Human Health Expert Group, there was an effort by the Sami Council to look at research ethics as a way to give them some guidance about what to do with, they had a whole set of leftover biologic specimens from basically a large sero survey that they did in their population. And they were looking for both legal and ethical guidance on how to manage those in the future. And we're doing some outreach for that. And so there has been some thinking in other populations about these questions. And of course, as you know, Roberto, there's some really good guidance documents that have been developed in Canada. The Navajo Nation has one.
Well, we are using a lot of those documents in our literature reviews. So we are not just solely relying on the domestic documents.
Of course, those are out there. I just wondered about active outreach, and if you want people to review this and give you feedback in this review process, or if you really want it just restricted to US respondents.
Primarily the U.S. respondents, but if feasible or as appropriate, we are looking to several outside reviewers as well. I have talked to several scholars in Canada, for example, and I know some of our other team members are looking as well outside the U.S.
Okay. Well, I won't do a lot to advertise it around then, if other than the posting that you've already done.
All right, thank you.
The version I'm looking at is that kind of one pager that you brought up when you were in Alaska in October. And is that the current version? Or I guess my question is, are you waiting to gather input to rewrite this, or have you actually done another version of this that might be
We have not done a revised draft at this point. We're waiting for the final input to come into the Federal Register notice and for the team to complete the targeted interviews.
Okay.
But we'll have a revised draft in March.
All right.
Anticipating sometime in March.
Great, thanks. I was looking at it yesterday and just trying to get a sense of whether I was looking at the most recent version or if there should be something else coming. So I'm preparing comments for you on this.
Oh, thank you, Tom.
Yeah. Thanks for organizing that.
Sure. All right then. I think we're ready to move on to our next update. There are no further questions. I'd like to welcome Carrie Nations from the U.S. Arctic Research Commission to provide us an update on the Arctic Mental Health Working Group. So Carrie, please take it away.
Okay, there. Can you hear me now?
Yes, we can hear you.
Okay, and is my slide showing properly? So thanks.
Yes, we can see slides.
Okay, thanks for inviting us to present on our working group. This is one of the 3 working groups that the U.S. Arctic Research Commission has, the others being on water and sanitation and renewable energy. And the Arctic Mental Health Working Group has been around since the end of 2015, so we're about 2 years old now. Let me see if I can move my slides ahead somehow. And our mission statement that we came up with was to strengthen systems of care to prevent suicide and improve mental health in the circumpolar north via promotion of Indigenous knowledge, research and evidence-based early intervention and primary prevention efforts. A lot of this came about by looking at the health disparities between Arctic and non-Arctic populations. And as an initial focus, we've chosen to look at suicide prevention with an emphasis on early intervention and approaches for children and youth, because that was something that seemed like it might need a little bit of bolstering. We have a pretty large group now. We're up to 20 members. Several of you are on the phone, including Roberto and Angela. It's a mix of clinicians and program managers and administrators. We have some Alaska Native people involved as well, rural community members involved. And so it's a large group and it's a well-rounded group. I think we meet quarterly, but between quarterly meetings, smaller subgroups meet to work on various efforts. We have 3 objectives that we've been working on for the last 2 years, and we've just started with a 4th objective. And you can see in the circle is our mission statement, and then the various objectives. The first one coming off of that circle is encourage data collection, integration, and analysis and research. The second one is to promote capacity development for mental and behavioral health workforce. The third is looking at protective factors and strengthening those mental health protective factors. And then our new one related to the last presentation we had was understanding the impacts of climate change on mental health. And so I'm going to go through each one of those, give you a little bit of our rationale behind that objective, and then what we've been up to try to work towards that. So the data objective, we know that there's a multitude of issues related to suicide and suicidality and behavioral health issues. And the group felt that it was really important to understand the issues from a broader viewpoint across the different public health and service systems. So for example, Office of Children's Services, Department of Health and Social Services, Department of Corrections, all these different agencies or systems that touch aspects of mental health but may not be talking to each other. And wouldn't it be great, or could it be productive to have them integrating their data in terms of figuring things out? And so our objectives to date have been sort of threefold. The first is to just encourage research and activities that improve communication among these agencies to address mental and behavioral health issues. Last January at the Alaska Public Health Association Health Summit, we hosted a session focused on integration of multiple data streams and how that could improve mental health care. We had a presentation about a suicide surveillance model for Alaska. We had a presentation from the Alaska Violent Death Reporting System, and we had a speaker from Office of Child Services present on their difficulty in trying to figure things out because they don't have data that's integrated with these other systems, and they felt that there was a lot more they could do if they had access to that data. And then thirdly, just in October, we hosted the first work session of the development of an Alaska suicide surveillance model. And this is an effort being led primarily by James Galanis of the Alaska Department of Health and Social Services. And that first meeting was really great. We had about 12 to 15 people in the room or on the phone that are related with mental health and suicide work. And everybody got together and talked and discussed things that were missing and things that where there were gaps and how do we bring this all together. There was a comment that a lot could be done. We didn't necessarily have to start at the beginning because the opioid surveillance team had been doing sort of a data library, and a lot of the same issues that come up for that issue are related to suicide as well. The second meeting of this group is going to be January 17th. I think at 3 o'clock in the afternoon, Alaska time. And this will be the second meeting to discuss how to go forward with developing some kind of a Alaska surveillance model, suicide surveillance model. And so those have been our main efforts to date. If you want to know more about the surveillance model, I can get you in touch with James Galanis, who's really leading that effort, but we're trying to, as the working group's trying to support him as much as possible in that effort. Our second objective was the workforce capacity one. We felt that an important part of addressing mental and behavioral health needs of children was the presence of mental health providers. We know that Alaska has a lower provider to population ratio than is available nationwide. And we also know that even in Alaska, a lot of those are in the rural community, are in the urban communities. And that makes the ratio discrepancy even greater in the rural communities where perhaps they're needed more. And so to look at addressing that, we've spent the last year gathering information and putting together a publication. It's a one-page, two-sided document on Alaska's mental health care workforce shortage. It looks at the various needs and provides research recommendations. This just came out in October. Just really quickly, I kind of outlined the 4 main research recommendations that this suggests. One is establishing Alaska-specific estimates for the numbers and types of mental health care providers needed. We were able to find a few studies looking at the national, that were based on national level things about, a community of this size needs this many psychiatrists and this many nurse practitioners and things like that. But nothing was really Alaska specific. And there was really only one of those studies that even included rural populations in their study. And so we thought it would be good to know what Alaska needs to address mental health needs. The second research recommendation that we came up with was understanding and predicting how the redesign of Alaska's Medicaid program and also the integration of mental and primary health care would impact this shortage of mental health care providers. Is integration of mental and primary care going to make more mental health care providers needed or less, things like that? How would that whole process of redesign and integration affect this shortage? We also recommended creating research-informed alternative approaches to providing mental health care. In Northern Canada, they do a lot of telepsychiatry. That there is some of that in Alaska, but not much that we could find out about. And so that's sort of one of the alternative approaches, but perhaps there's others. And again, looking at international places, people who have done this in other Arctic communities is a good place to start. And then our fourth one was to look at job satisfaction and retention to understand better how to grow and strengthen the mental health care workforce, particularly in rural areas. So those are sort of the take-home recommendations that the group came up with. We've been working hard to distribute this publication, and we're going to be having a session at the Alaska Public Health Association Health Summit in January. It's on the 16th. Oh, sorry, our session I think is on the 18th at 11:15 or so in the morning, and it's going to be mental and behavioral health workforce capacity needs. We're going to be talking a little bit about our publication. Cody Chip is going to be talking about the Alaska Psychiatry Intern Consortium, I think is the right, the APHA is what he calls it, but I think that's the right translation of the acronym. And then we also have Dr. Seth Green coming to talk about integration of mental and health care in rural communities. So if you're interested in that session at all, you're welcome to join us. The third objective the group looks at is protective factors. Here, the rationale is that you need to understand the impact of community and family and all the protective factors that support healthy development of youth, and need to understand the importance of also follow-up support for children and youth at risk. This subgroup, working group, has, we haven't done a lot. We've done a lot of talking, a lot of brainstorming, talking about different issues we could explore. Some of these we feel are being taken care of now with the collaborative hub that's now at UAF, the Anchor program. What I think this group is going to be working on in the coming years is some kind of white paper or review paper to kind of figure out what do we know about protective factors and suicide prevention in youth, specifically as it relates to Arctic communities. And so that's something that's coming up as we move forward. The last 2 years, we've been working on each of the first two objectives I've mentioned already. And so this year, I think, is probably turn for the protective factors objective to get a little attention and make a big effort on. And then our fourth one, which we've only just started looking at, is climate change and mental health impacts. We've had a couple of presentations from the Eco America folks on climate change and health impacts. We know that, from those presentations and that information, that it could be gradual changes, psychological consequences, and then there could be extreme consequences. This group is brand new. We had our first subgroup meeting earlier this month, and the plan is to start with a scan of the published and gray literature to determine what is already known about climate change and mental health in northern communities. I've been seeing a lot about climate change and health, but not a lot of it focusing on the northern communities. We know there's some literature from Canada, especially related to communities in northern Newfoundland and Labrador, but the group felt like we needed to do a bit of information collecting before we could really figure out what our first effort should be. And I think, I don't want us to repeat work, so I'm interested to see the health assessment that Sarah was talking about, because I think that would be sort of something maybe we can build off of rather than repeating work. And I think that brings me to the end. I hope that provides a little bit of information on what the Arctic Mental Health Working Group's been up to. So I'll take any questions if there are any.
Carrie, that was a great summary. Thanks very much.
You're welcome.
I've sort of lost track since I last saw the presentation that you guys did at the Health Summit a year ago. You've really carried it a long ways. One of the things that's worked for physician and mainly physician and dentist provider shortages in rural Alaska is to offer loan repayments, and those are managed through the state of Alaska, and it's been a legislative initiative. And I'm wondering if that was something that your group had discussed as offering that forward as a possibility to help the workforce for mental health in Alaska.
Yeah, we don't mention that specifically, but it has come up certainly in the information I was reading about ways that they've tried to do it in the past. And I think Cody might be mentioning part of that when he talks about the APIC program at the upcoming ALPHA. But we don't give specific recommendations about how. We just say this needs to be researched and dealt with, more than saying, okay, maybe we should do loan. But I mean, once this goes out, sort of the next step with that one pager is to get information from various groups and input about how we can address these research needs. And that's certainly one of them. We presented that one pager at the Alaska Native Health Research Conference and to try and get input. And that was one thing that was mentioned there as well.
Yeah. Another thing to consider is that there's these same issues, of course, are being talked about throughout the Arctic, and the work that NIH led for the Rising Sun Project really highlighted the interest that there is in the Arctic in mental health and suicide prevention. And next summer at the International Congress on Circumpolar Health in August 12th through 15th, there will be, this topic will be very much covered, and I think it would be great if your working group was represented at that meeting in the form of an abstract and presentation, because I think others in the Arctic would have a lot to say about this and a lot of interest. So I think, you know, it's something that maybe you and Cheryl and Roberto would want to talk about, is making sure that your efforts are represented at the upcoming ICCH meeting. I think Cody Chip probably will be attending that too, representing APIA. So I think there's options for having a pretty good contingent there. And I know that there would be a lot of interest in kind of this general approach, your bubble diagram that you had shown and the circle diagram. I think it's a different approach in the US than, say, some state-based solutions would be in some of the Nordic countries. And I think some good discussions could come out of that.
Great, thanks for that. I'll follow that up.
Great. Hey, this is Cheryl. Good job, Carrie. Thanks for making the presentation. I did want to mention as well regarding our climate change, our new add-on. We did have a session, a listening session, where we presented information on the working group and got input from participants at the Alaska Native Research Conference that ANTHC had in November. And it was interesting, towards the end of the input session, we got an awful lot of comments and concerns about the impacts of climate change on mental health in the Arctic, and that kind of pushed us over the edge. This was something that we had it had come up early on in our meeting, in the course of our meetings, and we had kind of put it on the back burner because we had enough on our plate. But now with the Anchor program kicking in, we are kind of pulling it back off the back burner and are trying to address it more directly.
Cheryl, one thing to connect you with and your group with is within the IARPIC structure, there's a new group that's been formed called the Coastal Resilience Team. And they're just formed in the last year, but I know what their focus has been is on rural Alaska coastal communities and the response to all the profound changes going on in those communities. And I think it would be a great opportunity to link with them and get more input. And there's some good thought leaders in that group, and it might be a productive kind of discussion to link your mental health working group and the efforts around that you're doing with climate change with that IARPIC group. And Roberto.
Great, Tom, I appreciate that input. We have the Adapt Alaska group has been kind of linking in with the Coastal Resilience Working Group as well. And Murray Green, our commissioner, is representing us on that and is very aware of what we're doing with this working group. So, yep, great idea. We will keep tracking that.
And thank you, Carrie and Tom and Cheryl for those additional comments and presentation. As you can see, there are important efforts that are moving forward for collaborations and partnerships in this area. With just a little bit under 10 minutes left, I want to welcome Marisa Rodriguez from the Tribal Health Research Office of the National Institutes of Health to give us an update on some of the exciting activities that the office is conducting. Marisa.
Thank you all so much for having me. Good morning and good afternoon. My name is Marisa Rodriguez, and I'm a health science policy analyst here at the Tribal Health Research Office at the NIH. And I work directly with and for Dr. David Wilson, and he's the director of the Tribal Health Research Office. And I also work with Edmund Keene, who is also a health science policy analyst here. And unfortunately, Dr. Wilson couldn't join us today. He is actually out visiting Navajo Nation right now, but that is why I'm here speaking on behalf of him as well as on behalf of our office. So I've been here for approximately 10 weeks, And our office has been doing so much. And again, we just thank you for allowing us to share some of the efforts that we've been working on. So I'll begin by telling you a little bit about Tribal Health Research Office. If you're not familiar with it, the THRO was established in 2015, so we're quite new. And the office was created to facilitate meaningful input from and collaboration with tribal nations on the NIH programs and policies. And we are a coordinating office for the tribal health research related activities across the NIH. THRO represents NIH to the tribal nations across the US. A priority for THRO is to make sure that the tribal nations have the information that they need to make informed decisions about health research. The NIH is committed to, pardon me, ensuring that the different cultures, traditions, and governments of the individual tribal nations are considered in the design and development of NIH research and initiatives. Incorporating perspectives and tribal nations is definitely paramount to NIH's approach to provide Native Americans with the benefits of high-level research. THRO also organizes meetings and workshops, committees, and other activities related to the tribal health research. This includes convening for annual tribal consultations during which the tribal leaders and community members are able to share recommendations or comments on NIH activities that may impact their communities and developing initiatives to support tribal health research. So some of the initiatives that we've been working on include, but are certainly not limited to, the following. We're currently conducting a research portfolio analysis of NIH's investment in research that is conducted in or with the tribal communities. From this analysis, NIH will gain a better understanding of the NIH's progress in this space. And currently, I'm working on developing a 5-year strategic plan that has been drafted with a tremendous amount of community input. Earlier this year, we held a national tribal consultation in Alaska around the office's strategic plan. And the tribal communities voiced the importance of 4 key elements to include in our strategic plan. So I've been working on that and hope to share with leadership sometime, hopefully later this week. So I'll tell you a little bit about our strategic plan and the elements included in it. The first one is increasing communication between the tribes and the NIH. The second is building research capacity in AIAN communities. The third is expanding research that affects tribal communities. And the fourth is overall practicing mindfulness of cultures, traditions, sovereignty, and that should be incorporated in the entire strategic plan. And then also a few other items that I wanted to mention. We are having a tribal consultation, and it's going to be an opioid consultation in May. And we are looking to partner up with SAMHSA, IHS, NIHB, and 6 other ICs here at the NIH. So again, that's in May. And we're also looking to, I apologize. So we're collaborating with some other offices here at the NIH to develop a best practices document. And last week, we actually had a day-long meeting that helped us shape the direction of the document. And it included some experts that I'm sure you're all familiar with, Dr. Richard Nakamura, Dr. Anderson of the NIH, Denise Dillard, and Dr. Sparrow Manson. So that was wonderful, and we're definitely looking to move forward full throttle on that as well. So I hope that gave you all a little bit of insight on what we're currently working on, and thank you again so much for inviting us to share some of the efforts.
That was great, Marisa. Thank you. Does anyone have questions for her? I'll just add that as the NIMH representative to the Tribal Health Research Coordinating Committee, I've been involved in a number of these activities supporting the Tribal Health Research Office and Dr. Wilson. And I think importantly, this resource that is best practices, or I guess more accurately, it's now called Points to Consider, in AIAN, research in the health sciences, aligns very well with our IARPIC revision of the principles for the conduct of research in the Arctic. And so I feel like I'm a conduit between these two approaches, and I want to make sure that there is coordination as we move forward. So rest assured, I'll be sort of going back and forth between IARPIC and the Tropical Health Research Office to make sure that we have good communication coordination as we go forward.
Excellent. Thank you.
All right, we just have a couple of minutes left. Now's the time for any updates from the membership, the participants on the call, if you'd like to share. If not, I'll just say that our next meeting will be in January, not at our regular third Tuesday of the month because of a conflict with the Alaska Public Health Summit, but we will be meeting in coincidence with the One Health group on Tuesday, January 23rd at 10 a.m. Alaska time. Is that correct, Tom?
That's right. We have been tapping into that Alaska Canada One Health work group as one of our regular meeting locations. So you've got the date right, the 23rd, 10 in the morning. And we're developing the agenda now, but that one is a little longer. It's a 2-hour meeting because we have updates and then there's the scientific presentation. So